Small round cell tumor, SRCT, is a rare subtype of malignant mesothelioma that predominantly affects children and young adults. Due to its aggressive nature and poor response to traditional therapies, chemotherapy is often used as the primary treatment approach for SRCT mesothelioma. However, chemotherapy is a strong and intensive treatment that can cause many temporary and potentially long-lasting side effects. The specific side effects experienced may vary depending on the type of chemotherapy, drugs used, dosage, treatment schedule, and individual patient factors. Some of the most common side effects associated with chemotherapy for SRCT mesothelioma include hair loss, alopecia. Many chemotherapy drugs can cause hair loss all over the body, including the scalp, eyebrows, eyelashes, and other parts of the body where hair grows. Hair loss is usually temporary and the hair will regrow once treatment is finished. However, for some people, hair may not regrow or may regrow with a different texture. Nausea and vomiting. Nausea and vomiting are very common side effects of chemotherapy and vary in severity depending on the chemotherapy drugs used. Anti-nausea medications can help prevent and reduce nausea for many patients. Vomiting may occur within minutes or hours after chemotherapy infusion. Nausea and vomiting may persist for several days after treatment. Fatigue. Fatigue and lack of energy are very common during and after chemotherapy. This is referred to as chemotherapy-induced fatigue. It can last for several days or weeks after treatment and may interfere with daily activities and reduce quality of life. Managing sleep, activity, and nutrition can help reduce fatigue. Low blood cell counts, myelosuppression. Chemotherapy drugs work by targeting rapidly dividing cells like cancer cells. However, they can also damage healthy cells with rapid turnover like blood cells. This can lead to low red blood cell counts, anemia, low white blood cell counts, leukopenia, neutropenia, and low platelet counts, thrombocytopenia. This makes patients more prone to infection, excessive bleeding, and fatigue. Blood counts typically reach their lowest point around 10 to 14 days after treatment and then recover over several weeks. Growth factor injections or transfusions may be needed to boost blood counts after chemotherapy. Mouth sores, mucositis. Mucositis refers to inflammation and sores that can develop in the mouth, throat, esophagus, and gastrointestinal tract due to chemotherapy. Mouth sores are very painful and can cause problems with eating, swallowing, and speaking. They usually develop 5 to 10 days after chemotherapy and may last up to 2 to 3 weeks. Good oral hygiene is important to prevent infections. Pain medications and mouthwashes can help relieve pain and treat sores. Skin changes. Some chemotherapy drugs can cause hand-foot syndrome, also called palmar-plantar erythrodysesthesia. This results in redness, swelling, blistering, or peeling of the hands and feet. Hair follicles may also be affected, leading to changes like discoloration of fingernails and toenails. Radiation therapy for mesothelioma can also cause skin changes at or near the treatment site. Diarrhea. Chemotherapy can damage the lining of the digestive tract and cause loose, watery bowel movements and abdominal cramping. This is referred to as chemotherapy-induced diarrhea. Antidiarrheal medications are available to manage symptoms. Ensuring adequate nutrition and hydration is important to prevent dehydration and weight loss from diarrhea. Digestive issues, nausea, vomiting, diarrhea, and mouth sores from chemotherapy can all negatively impact appetite and nutrition intake. This may lead to indigestion, heartburn, constipation, or changes to bowel habits in some patients. Management involves dietary changes, digestive aids, and medicines as needed. Nutritional supplements may also be recommended. Changes in taste and smell. Chemotherapy can sometimes temporarily alter taste and smell. Food may taste strange or unpleasant. Loss of taste makes it harder for patients to maintain nutrition and hydration levels. Taste and smell changes usually resolve once treatment ends. Fatigue. Menstrual changes. Younger female patients may experience temporary changes to their menstrual periods during chemotherapy, like irregular, absent, or heavy bleeding. This is usually not serious or long-lasting. Fatigue and mood changes are also common side effects for female patients that can mimic premenstrual symptoms. Sexual dysfunction, issues with libido, arousal, orgasm and fertility may arise due to chemotherapy's effect on hormone levels, fatigue levels and self-image changes. This is an important concern for younger patients that needs communication and counseling. Most sexual side effects resolve after treatment completion. However, fertility may be permanently impacted. Egg or sperm banking before chemotherapy is advised for patients wishing to have children in the future. Cognitive changes. Some patients report experiencing memory issues, difficulty concentrating or chemo brain during or after chemotherapy for a period of time. The mechanism and severity of these cognitive side effects is not fully understood. They seem to be temporary for most people but may persist long-term in rare cases. Secondary cancers. While rare, some chemotherapy drugs have been associated with a slightly increased long-term risk of developing another type of cancer later on. Careful risk-benefit assessment and close follow-up is important for survivors. Managing side effects is crucial for quality of life during treatment. Symptom control involving medications, lifestyle changes, support groups and counseling helps patients tolerate their chemotherapy better. Most chemotherapy side effects are temporary and resolve on their own once treatment stops. However, some can persist or have long-lasting health impacts that require ongoing care. Prompt reporting of side effects to the healthcare team is important for tailored symptom management. Chemotherapy for SRCT mesothelioma has significant potential side effects impacting many organ systems due to its intense, whole-body effects. A multidisciplinary care approach focusing on prevention, education and treatment of side effects is needed to optimize patient outcomes and experience with this aggressive treatment.